Why are CF lung infections so persistent to prevent? Imagine trying to clear a clogged drain that keeps filling up with thick, sticky goo. That's similar to what happens in the lungs of someone with cystic fibrosis. The disease causes the lungs to produce abnormally thick and sticky mucus, which traps bacteria and prevents the body's natural defenses from removing them. Normally, tiny hair-like structures called cilia move mucus and trap germs out of the lungs, but in cystic fibrosis, this process is severely impaired. The mucus becomes a perfect environment for bacteria to settle and grow, leading to chronic infections that are hard to get rid of. One of the main culprits behind these persistent infections is a bacteria called Pseudomonas aeruginosa. This bacteria can form protective communities called biofilms, which are like slimy shields made of polysaccharides. These biofilms act as a fortress, protecting the bacteria from antibiotics and immune cells. Because of this shield, antibiotics often struggle to reach and kill the bacteria effectively, making infections stubborn and long-lasting. The immune response in cystic fibrosis lungs adds another layer of complexity. The body sends a flood of immune cells called neutrophils to fight the infection. While neutrophils are essential for fighting germs, in CF they releases enzymes like elastase that damage lung tissue. This damage worsens lung function and creates more space for bacteria to thrive. Instead of clearing the infection, the immune response can inadvertently help bacteria persist, creating a vicious cycle of inflammation and damage. The lungs of someone with cystic fibrosis are also highly variable. Different parts of the lungs can have different oxygen levels and nutrient supplies, allowing bacteria to adapt and survive in these microenvironments. Over time, bacteria can develop resistance to antibiotics, making treatment even more challenging. This adaptability means that even with aggressive therapy, bacteria can persist and continue damaging the lungs. Persistent infections lead to ongoing inflammation, which gradually destroys lung tissue. As the lungs become more damaged, their ability to clear bacteria diminishes further. Some areas of the lung may become so scarred that they cannot effectively participate in fighting infections anymore. Even in less damaged regions, bacteria can still find ways to survive, making prevention and eradication difficult. Despite advances in treatments that improve lung function, such as CFTR modulators, completely eradicating these infections remains a challenge. The protective biofilms, bacterial resistance, and the altered immune response all contribute to the difficulty. Preventing cross-infection between patients is also crucial because bacteria can be shared, especially in healthcare settings or support groups. Infection control measures include strict hygiene, wearing masks, and avoiding contact with infected individuals to reduce the risk of spreading bacteria. In summary, cystic fibrosis lung infections are so persistent because the disease creates an environment that traps bacteria in thick mucus and biofilms, while the immune system's response can cause more damage than help. Bacteria adapt quickly to their surroundings and develop resistance, making infections resistant to treatment. This complex interplay of factors means that managing these infections requires ongoing, comprehensive strategies focused on infection prevention, airway clearance, and careful use of antibiotics. Always consult healthcare professionals for personalized advice and treatment options tailored to individual needs.